Hi everyone, my name is Isabella Farina. I am a junior here at Binghamton and I'm on the women's softball team. For my final project, I decided to do something a little bit different. This is a podcast episode where I interview 3 of my current teammates on the softball team and just ask them a couple questions about their experience with women's health professionals in their lifetime. So the goal of this podcast episode was essentially to bring awareness. You're going to hear all sorts of different experiences, and this is just to show that it's okay to find a provider that you click with, that you have a good relationship with. It's actually the most important to have a solid line of communication, as well as advocate for yourself. Educate and advocate for yourself. It is the 2 things I wish that I knew when I started this journey. My journey looks a little bit different than most. I'm currently diagnosed with endometriosis and adenomyosis, which are 2 uterine tissue diseases, but it actually took me almost 4 years to get a real diagnosis. I started seeing my gynecologist when I was 15 or 16, and all I can say is at the time I was very uneducated, and if I had been educated on my own body and treatment options, this 4-year time period of waiting for a diagnosis would not have been that long, or tiring actually. I went in as a very naive, young teenager who was just in pain, who was in debilitating pain every month and wanted it to go away. And all of my friends at school had been put on birth control by their gynecologists, and they said that it had cured everything. So when my gyno recommended birth control, I was ready to go. And she never really explained to me what that was truly doing to my body. It wasn't until my brother's fiance, who was a menstrual coach, explained to me what I was doing to myself and showed me how to educate myself on my body that I realized that this is not something that I wanted to continue doing. And I was very upset that my gyno had never really explained what this pill was doing to me. She had just put me on it and set me on my way. When I had told my gyno that I had gotten off the pill and did not want to go back on it, she was disappointed. I could see it all over her face and her body language. And this continued on for, I would say, almost 2 years after getting off the pill, where every time I would go in explaining how bad my symptoms were that month, she would just continue to push that as my only treatment option. It really showed me how important it is to be educated on your own body and your own treatment plans before you agree to anything. And that professionals aren't an end-all be-all solution. They don't always know the right answer. And that was something that I had never experienced before. I had always thought that these professionals knew it all, and they would take care of me and they would make the problems go away. And that's not the reality. And it actually took my mom coming to an appointment. I was so done with being looked over because I was young and I didn't know any better, that I brought my mom, who had suffered endo when she was about my age. And endo is a very genetic disease, so my gyno listened to her. And that was the most eye-opening part, because it took almost, again, 4 years, and within 10 minutes of my mom being in the room, we had an ultrasound in the books. And as awful as this experience was for me, now that I finally have my diagnosis and I've been able to process it a little bit in this last year, I've really been grateful that my eyes were open so much, because I would have never learned how to advocate for myself if it wasn't for this experience. I wish I had known it going in, obviously, but this is how you learn. And I wanted to share this experience so hopefully you guys can understand how important it is to learn it while we're young, especially as young women. All right, our first guest on the pod is going to be B. Hi, B.
Hi.
Do you want to introduce yourself for everyone?
Yes. So my name is B, and I'm 23 years old. I'm currently a member of the softball team. I grew up right outside of San Francisco in California in a little place called San Mateo, and I am currently working on my master's of public health.
All right, my first question for you is, have you been diagnosed with anything regarding women's health?
I've not been diagnosed with anything specifically in the past. There wasn't a lot of diagnosis or clinical trial behind that, but from what I was describing, they'd called it heavy menstrual bleeding.
Gotcha. And have you used the same provider since you've started seeing a women's health professional?
I did up until a few years ago. She ended up retiring, but she was phenomenal.
So you said she retired. Now, how would you compare your old professional to the new one that you have?
So my situation's a little finicky in the sense that I'm from California, so I do go home time to time to see my family, and that's when I would go home, and I'd also see someone like my OBGYN. I was doing that for a while, and once she retired, I was like, I should probably try and see what is in New York. So I had a provider here in New York, and I had a meeting or two with her, because at the time I started experiencing really odd like menstrual bleeding again, and that interaction was not phenomenal. So I then had to switch providers again. It's still in New York, but even then I had to go ahead and make appointments with California providers because I felt like I was getting a better interaction, appointment, all of those types of things in California.
Can I ask what specifically from those appointments in California did you feel like was better? Like what aspects of the appointment?
Yeah, so I will say the first time I saw an OBGYN, I was about 15 or 16, and that's a time where you feel pretty uncomfortable with everything, especially the OBGYN, because you're still trying to understand your own body, and now you're introducing another person who's examining you. It's just a lot to kind of take in. So I was younger and I felt extremely comfortable. My provider definitely made me feel like I had options and choices. We tried quite a few things to try and handle my period because at the time it was pretty debilitating. And so she just made me feel very cared for and was very good at taking the time to explain things to me and make me feel like I could have decisions in this matter. My first New York provider, it was really weird, in my opinion, the interaction, because I went in and I was suddenly having heavy menstrual bleeding again after not having a period for 5 years. That was kind of expected with the timeline of the Mirena, but I wasn't really aware of that at the time. So when I went to see her, she kind of told me what to do, and I wasn't a fan of that option, and I told her I wasn't a fan of the option, and she kind of was upset with me. It was really weird, and I didn't really want to argue with the provider, and I could totally understand that they have a lot of medical knowledge and advice, but also some of the recommendations I knew were not requirements, and they overstepped my comfort boundaries. So after the appointment, I decided I don't think our interaction was great. We didn't click well. Maybe I'll try another provider and see, if not only for a second opinion, but just see if we clicked better. And I will say my newer provider in New York, I think we click a lot better. I think we communicate well. And I think she's more personable with me. But the only thing is she seems to always kind of be in a rush when she's talking. It's really weird. Like she needs to go somewhere now, no matter what the appointment's for. That and sometimes she says things that are a little concerning, like when I was talking about my Mirena IUD, she's like, yeah, I've been changing them after 5 years in case. And I was like, girl. And I should have asked this, but I was like, in case of what? Like, things like that where I'm like, what are we talking about? But, yeah, I would say that my original California experience was really good because my provider made me feel like I had a lot of autonomy. She was really good at explaining things, and she made me feel really comfortable being there.
Gotcha. And my last question for you, B, would be, growing up in California, do you think that being in a comfortable place like home made it easier to find a provider? Or did you find it hard to find somebody out in New York because you didn't know the area and you were kind of relying on people you know to give recommendations?
That's a very good question, and that's a great question because I had that exact experience where I at home felt like I found a good provider very quickly, very easily. I'd lived there for 18 years. My mom was born and raised there, so she had a lot of footing in the area, and she was more aware of different clinics and different providers. So the provider she had is who I ended up having, and that's how I found out about them. And so in the same way, when I moved to New York, I thought, okay, I'm going to ask some of my friends who they have, what they think. And I automatically struggled because I didn't realize a lot of people don't have an OBGYN. So I was like, okay, that's not a great start. Yeah, I would definitely say it's taken more trial and error because I don't have family members here that have good experiences like I did in California, and a lot of my friends didn't have OBGYN, so I had to figure that out for myself. And it's been interesting, and I'm good now, but it was definitely like a journey to get to where I am.
Gotcha. Well, I really appreciate you sharing. I think it's super impressive that you were able to stand up for yourself and find people who you really trust and are comfortable with. And I think a lot of females struggle to do that. So thank you for sharing with us.
Absolutely. Thanks for talking with me.
Of course. All right, our next guest on the pod is going to be Akira. Hey, Kika.
Hey, Bella. Thanks for having me.
Do you want to introduce yourself?
Yeah, I'm a junior here at Bing. I major in neuroscience, and I'm minoring in sociology, and I'm also on the softball team with Bella.
Okay, Kika, so you're under 21, so that means you don't have to see an OBGYN regularly, but have you been or do you have a set women's health professional?
I've been to an OB once, but I don't have a set professional right now, just because it was a one-time appointment and I haven't been back since.
So how old were you when you went, and why did you go?
I was 16 when I went, and I was experiencing some symptoms of amenorrhea, which is losing your period for an extended amount of time. And I just kind of wanted to get an opinion from a women's health professional and see if there was something I could do about it.
Okay, gotcha. So you said you got a little bit of a diagnosis. Was it a clear diagnosis, or was it kind of, this might be what you have?
It was a clear diagnosis. We had talked for a while over the phone and kind of like a telehealth appointment about my symptoms. And then when I went to go meet her in person, she diagnosed me with athletic-induced amenorrhea.
Okay, so having a diagnosis of amenorrhea from the athletics that you partake in, did they give you any possible treatment plans?
When I went for the appointment in person, we talked for a while. It was kind of at the same time that the U.S. women's soccer team was going through their stages of like publicly talking about their cycles and how to be a female athlete and manage your cycle. So I did get to talk to my provider at length because she had a background in athletics and just was very knowledgeable about kind of what female athletes went through in terms of the taxing nature of their sport on their bodies. So the diagnosis was clear, and I felt like she definitely gave me time and attention in helping me diagnose it.
Got you. So for treatment plans, like, would you say that there was something set that you could have done, or was it kind of just you have to continue through it in your sport?
So she kind of talked, as we were talking about the women's soccer team, about how it's rather normal for female athletes to lose their period just because we're working out so hard, and oftentimes that means even though you're eating enough or what you would perceive as enough, your body's actually in a severe calorie deficit. So we did talk about that, and kind of the feedback that she gave me was that my calorie intake would have to improve greatly, and doing that for an extended amount of time would allow my period to come back. But the nature of playing my sport and being a multi-sport athlete might also mean that I was eating until or past fullness and still not seeing my period come back just because my body was always burning more calories than I was consuming.
Okay, so you spoke about how you had an in-length conversation with your provider, and I just want to go into a little bit how that conversation made you feel. For example, was it comfortable? Did it feel rushed? And what exactly made it feel that way?
So because my provider had an experience in athletics growing up, I felt like what she was saying about her past experiences and just her knowledge of female athletes really resonated with me and made me feel seen as a patient. And I know that she was someone who was hard to get into. She had a packed schedule, but she did not make me feel like I was a burden to her at all. I never felt like the appointment was a rush, and so I really appreciated that, especially having a bunch of family members, including my mom in healthcare. I know how quickly they often have to move, and I never felt like she wanted to just get me out of there and see the next patient.
That's really awesome. A lot of females don't experience that same experience. So when you were having that conversation, did she use words that were easy to understand, or did she throw in a lot of medical jargon?
Yeah, she definitely used words that were easy to understand. I never felt like I was confused, and I think that's especially important because it was the first time I'd ever seen a women's health professional, and I was also very young at the time, so I think that I would have felt extremely overwhelmed had she been using terms that I didn't understand.
Gotcha. So overall, you say you had a pretty positive experience with this OBGYN?
Yeah, I would definitely say I did, and if I end up going back to an OB in my hometown, I would definitely revisit her office.
Got you. That's awesome. Well, thank you so much for sharing.
Thanks for having me.
And for our last guest of the podcast, we have Livy.
Hi, my name's Olivia Kennedy. I am a junior, and I'm from Binghamton, New York, so right around the Binghamton area.
Awesome. And what brought you to see a women's health professional in the first place?
So ever since I was younger and I had started my period, I've always had issues of it never really being consistent. It would skip 5 to 6 months at a time, which obviously isn't very normal. And everyone had always told me, it's because you're so active, it's because you're so active. But then I soon, realized once I was in high school and college that wasn't really normal. So when I started my freshman year of college, my period was still the same. It was super irregular. And then I started having dark facial hair grow all over my face, and I was had no idea where that was coming from because I never had issues with that before. So I started to talk to my mom about it, and we didn't want to go to a regular doctor because I just didn't want to be put on birth control. And that was something that my mom's been big on because she's also someone that's wants to go a more natural way, and she's always been like that. even with like foods and stuff. So she had found this naturopathic doctor in Binghamton, and she had gone to her and had really great feedback about her. So I decided to give her a try, and I was telling her all of my symptoms, and she was super great, super understanding, super knowledgeable, which I feel like that's a common like mistake when people think of natural doctors, that they don't really know anything, and that's why they went the natural route. But she was super knowledgeable about everything. And we ended up doing a urine test, so it basically took like a sample of all my different hormones. It gave me a sample of like my testosterone, my androgens, my progesterone, my estrogen, and like it was like 20 pages of different things. It was actually like super helpful. So as she looked at it, she told me that my progesterone and estrogen levels were absolutely like at 0, and that's why I wasn't ovulating, which is obviously an issue. So she put me on a couple different supplements to like help with that and regulate things. One was like a progesterone cream, just like different things that were going to help my hormones. So I've probably been seeing her for almost a year, and she's helped me a ton, but obviously my hormones are super out of whack, so still trying to like figure that out. But she's been amazing, and it's just helpful to know that there's another fix besides like birth control.
That's really awesome. So you talk about how great your experience was with this woman. Would you say that you had a very good like patient to provider relationship with her?
Yeah, definitely. Every time my mom also goes to her too. So my mom would come in with me, and she was just always so like understanding of everything that we would talk about, like all of our problems, what we were comfortable with, what we weren't comfortable with. And if there were like supplements or a route that we didn't really want to take, she was super like adaptive to that. But there were even some times where it wasn't even about my period, and it was about like different athletic things, about like my hips being out of place and stuff, and she was giving me like tips about that and what her daughter would do. So it was very like personal. She would always talk about her family and like what her daughters were going through, but like not in a weird way, but I don't know, just like a super helpful way. So me and my mom, we just love her, and like I don't think we'll ever like not go to her anymore.
That's really awesome that you found somebody so good. All right, and my last question for you. Now, what you're telling me seems like you got a very holistic approach in treating your symptoms. And obviously you didn't see a regular doctor, so you can't really tell me exactly what it would be like. But do you think you would have gotten this really unique, personalized care if it was with somebody who wasn't treating you as a whole with your environments included?
I don't think so, because, and obviously I don't know 100%, but I think that I've talked to a lot of my friends, specifically the one friend that actually recommended me this natural doctor. And she had told me that all of the different gynecologists that she's gone to, all they wanted to do was stick her on birth control. And when she said that she wasn't going to do it, they said, well, then I can't help you. You need to leave. And she was like, okay, well, now I'm lost. I don't know what to do. I have terrible, painful periods. I'm on the floor every single month, like unsure what to do. I don't think all gynos are like that at all, so I don't like want to say that, but I just think, like, all the experiences that I've heard with all my friends and everybody, it's always been, like, well, I can't help you if you don't want to go on birth control, which I think is really scary to know that there are a lot of problems that people have, and they just want to be masked with birth control. And I think that this lady always wanted to, like, listen to what I had to say and how I felt, and I don't necessarily know if I would have gotten that with them.
That's really awesome. Well, thank you so much for sharing.
Yes, thank you for having me.
Of course. And that is all I have when it comes to interviews for this podcast. But before I say anything else, I just want to thank these girls for coming on here and sharing their stories, because it's not easy to do so. These are all very personal matters and can be very traumatizing at times. But them coming on here gives me the ability to spread awareness and really show what we've learned in this class this semester. Throughout these interviews, they honestly tackle almost all of the main themes that we discussed this semester in class. From location and accessibility in B's scenario, where in California, her hometown, she had her mother's gyno. She retired, came to a new state, and really struggled to find a provider that she was comfortable with. But B's a very great example of how you stand up for yourself in that case, and you don't just settle for someone you're not comfortable with. Because your provider is someone you should trust. They handle, especially women's health professionals, handle a lot of personal matters. Whereas Akira, on the other hand, had only been to a health professional once and was told that her symptoms were normal because she was so active. But she had such a comfortable conversation, an open and honest conversation with her provider, that she didn't feel confused at all leaving there, and she had a clear diagnosis and how to treat it. Now, as positive as that experience was, she was still told that her symptoms were normal because she's active, and that was a theme throughout all these interviews, that is just not the truth. And I think that really resonated with me when I was thinking about the myth of normal that we talked about in class. Even in Livy's story, you see that she was told that her symptoms are normal because she's active. This is not the truth, ladies. It is not normal to not have your period just because you're very physically active. And both Akira's and Liv's stories touched on how they were treating that. But the reality is, it is normalized way too often. My own personal story involved me being told that my symptoms were normal. And it's not fair to women because it really almost diminishes what they're feeling. And periods aren't supposed to be debilitating. And then arguably the most important thing we talked about in this class was touched on in Livy's interview with her experience with a holistic doctor. She saw a naturopathic gynecologist who, instead of pushing birth control with that for-profit method of the regular medical field, she truly found the imbalance of her hormones, which is the underlying reason for her debilitating symptoms, and then treated that with things like supplements and how she's eating first before they even looked at anything else. They treated how much she was active, when she was eating certain foods, the position of her pelvis. And that is something that you definitely did not hear in any of those other testimonies that my friends just spoke about today. Even in my own experience, I have never had anyone ask me about any of those things. And even with just 4 personal experiences, you see almost all of the themes that this entire semester was about. And bringing awareness to that and just teaching women how to look for the signs of what's healthy and what's unhealthy, I think would be super important. And my takeaways, the last thing I want to mention is how I related Liv's own experience to the People's Hospital as well, because the myth of normal and the People's Hospital were the 2 main readings that really pushed me to ask the questions that I did and have these women share their stories. The holistic approach of that doctor really reminded me of something similar to a safety net. Obviously, it's very, very different, but not for profit, really just trying to treat the root causes and the body as a whole instead of pushing medication because it's easy and fast. And then with the myth of normal, just the general normalization of symptoms that aren't truly normal and the loads of unconscious bias and medical blindness that we don't have as women because everybody thinks that what we go through is normal when it's really not. It's not supposed to be debilitating. So thank you for listening. I hope you enjoyed these stories. If there are any questions or you'd like to hear anything more, please reach out. I had a lot of fun doing this and I really love this class, so thank you.